Hey guys, Ashley with Amare, and today we are going to talk about something that you guys constantly ask me about, which is lipo. So what is lipo? Lipo is short for liposuction. It's that new fun thing that everybody's getting done where they go in and they suck out all your fat and then you recover and you're somehow a million times skinnier, right? So how does this work? What does it look like? It is very gruesome, guys. It's not as pretty as everybody thinks it is, and the recovery is not always as pretty. So let's talk about what it is first. Liposuction. Lipo is fat and suction. They are literally suctioning out your fat. How does that work? Well, in any kind of lipo, because there are tons of different kinds of lipo. Everybody does it differently. There's Vaser, there's Smart, there's AirSculpt, there's TrueSculpt. There's all these different kinds of lipo. But what are they doing? In all kinds of lipo, no matter what it is, they are going into your body, creating a hole, taking something that looks like a straw, pretty much, and it's got like a serrated edge, or it's got like a type of tip that goes in through the incision into your body. Then they do this kind of motion inside of you, and what they're doing is they're piercing, and they are kind of like scraping, depending on what kind of lipo it is, and scraping up the fat, and then it gets sucked through the tube into this big kind of jar that you'll see. If you guys watch any of those YouTube videos that show you like AirSculpt or TrueSculpt, any kind of lipo like that, you'll see that there's like a container of fat at the end, mixed with some sort of fluids. So it is all invasive. Even something like Elite's AirSculpt or Sculpt by SonoBello, they are all still invasive. Even though they are minimally invasive, they are still going into your body. It is still a procedure, and there is still some kind of either laughing gas or anesthesia or something used to help sedate you a little bit to get rid of the pain. So let's talk about the different kinds of lipo. So now that we know that lipo is any kind of procedure that fat is being sucked out of your body, liposuction, what is it and what are the different kinds? So Smart Lipo, Vaser Lipo, all these different, there's UL therapy is kind of along the same lines. It's not lipo, it's a little different though. But they all use different types of frequency, radiation, vibration, or ultrasound, or light, or all kinds of different things to help melt the fat to make the process less invasive on the body. Again, the key word there is less invasive, guys. Please take this seriously. Lipo is not a little procedure. It is not like getting a tattoo. It's not something simple like that. None of these cosmetic procedures are that simple. There's always more. So first of all, your body's going to go under the anesthesia, and that's going to take a toll on you to begin with. Second of all, you are getting cut up internally all the way around. So you can go as little as doing lipo just to your flanks, which is like the love handle area, or just to the stomach, or just to like the bra rolls, and that's still, lipo. It's still going to take a little while to heal. Or you can do your full mommy makeover, which is where you're doing lipo of the inner arms right in here, the inner thighs, the entire front of the stomach, the sides, the entire back, upper to lower, 360. So what does lipo 360 mean? You hear that all the time. Lipo 360 just means 360 degrees around the body. Traditional lipo or power assisted lipo is literally just that cannula, that tube with a serrated edge or something, and it sucks out of the body. They're still doing all of that traditional lipo. The scars from traditional lipo are generally a lot worse than all of the other kinds because of the cannula and because of the amount of abuse that the body takes with that rough motion where they're like jabbing in under the skin to get all that fat out. So those incisions usually are a little bit bigger and take a little bit longer to heal. Now, traditional lipo can do a lot more as far as body mass index. How much lipo do we know is too much? Well, it varies. Usually anywhere from 2 to 4 liters is a pretty safe range. When you get to 5 liters, that's a little bit much. I know out in Miami, depending on the body mass index and how healthy you are, I've heard things as crazy as 7 liters, which is anywhere from like 11 to 15 pounds of fat being taken out of you. And those same clients who I've heard that from have also told me that right after surgery, right off the table, they are fainting, they are passing out, they're anemic, they can't travel for days, they're stuck in Miami where they don't want to be because they did all of this extra that shouldn't have been done and wasn't healthy. So lipo can go from a little to a lot, and that depends on what procedure you have. So how do we know which procedure is good? So I myself have never gotten any of these procedures done. I work out, I try to stay very healthy, But, you know, everybody's curious. How do you know? How do you know what to do, when to do it? Well, it depends. It depends on the goal you're trying to achieve. So if you're doing something that's very, very small and you want sculpting, you want to try lipo. But if you're looking for some miracle to kind of get you super, super skinny without ever having to work out or ever having to eat great, lipo is not the thing at all for you. And you might want to try something like gastric bypass or a sleeve or something like that, because this is not weight loss surgery, guys. Liposuction is not weight loss surgery. It is for sculpting. It's for shaping your body. Yes, some of the fat is being taken out. Yes, even with a tummy tuck, you're getting skin taken out, but it is not meant for weight loss. It is not safe for weight loss. Anything more than 10 to 15 pounds, and even 15 pounds is a lot. You should not be losing weight. So the best thing you can do after lipo is get away from the scale, guys. It is not for weight loss. You're never gonna see results like that. It is for sculpting and shaping. On all of our before and after videos, you can see that. You can see the sculpt of the body. You can see the shape. We tell you what kind of lipo it is. We tell you what they had done and where, because again, it's about body shape, not body mass. So now that we've gone past that, different kinds of lipo for different things. So something like an airsculpt or a tri-sculpt, which is either Goals Plastic Surgery, SonoBello, or Elite, which are like the three big names in plastic surgery. Those guys are good for a little bit, if you have a little bit of lipo that needs to be done. If you're looking to do a lot of areas and do a lot of different things with your body with the lipo, like a full, 360 with the arms and the legs, you're definitely gonna want to go find yourself a doctor that can do the lipo. So there's smart lipo, there's Vaser lipo, there is also something called safe lipo, which is where they inject fluid into you to make it a little bit more less painful, like they make the fat a little bit easier to come out. So every doctor has a different technique. Every doctor has a different way of doing things. I would suggest doing your research. We are going to be doing videos on each specific type of lipo and what they all entail and what they do and the specifics of each kind, but try going with ones that you've had consults for, ones that the doctor has fully explained to you what kind of lipo it is, because that makes a huge difference in your recovery. So again, guys, this is not like a little tattoo. All of these surgeries, all of these procedures, they are all major procedures. Even if they say the downtime is 2 weeks, it's still a major procedure. You're still at risk for scar tissue. You're still at risk for fibrosis. You're still at risk for hardness. You're still going to have numbness. Yes, you're going to have major work done to your body. So picture all the areas you had done being a giant scab for like 2 months. We, of course, at Amare cut that time in half with manual lymph drainage and our protocols and doing the garments and measuring and making sure that you have the proper tools and things to help you through your post-op, to help your body detox the anesthesia, to help your body and your tissue heal. Because again, they're taking out the layer between the fascia and the skin. So how it works is you have skin, then you've got all the fat, then you've got a layer of like another thin like tissue, and then you've got muscle. So what they're doing is they're going on that second in-between layer where all the fat is, and they're removing that. So now your skin and your fascia are just kind of floating, hanging out here with nothing in between. So it's going to take a little time. Once the fluid comes out, once we manual lymphatically drain all of that fluid in between where there's no more fat, it's all just fluid. The quicker we take that fluid out, the quicker your skin and your fascia can meet and start to heal and reattach, which is why we cut healing down time to half, especially with lipo. Lipo is our easiest procedure to do that with, because all you have to do is worry about your body closing and healing back up flat and smooth without fluid in the way. Your biggest thing in lipo, because we want you to be smooth and we want you to make sure that you have that beautiful contour that you paid so much for, is making sure your swelling is in control and going down every single day. If it is not, it is possibly your garment, it is your diet, it is you're not draining properly, or you're not coming to get manual lymph drainage. So all of these things is what we cover, so that we make sure you are healing smooth and getting the results that you want from whatever kind of lipo it is. Something like a BBL, which is a Brazilian butt lift, or a fat transfer, or a breast reduction, or a breast enhancement with implants, those things take a little bit more time to heal, because you're talking about putting things into the body rather than just taking them out. Lipo is the easiest procedure to heal from if you do it right. Otherwise, you will wind up bigger and swollen and more round, and more with that tire or dog ears or all these common things that you hear people throw around after lipo, saying that they've been botched, which I hear a lot. A lot of times it's just swelling that you never took care of, or you just didn't have any aftercare, or your garment doesn't fit right, or you chose to not wear your garment, or you had tons of salt and not enough water. There's a million factors that we go over individually with each client. But I can tell you that unless your doctor did not take out the fat, there is no way from lipo that you can wind up botched. I've seen botched scars from a tummy tuck where the scar is slanted or curvy or held together with staples and not properly sutured, and it turns out to be a mess. But with lipo, as long as they are doing it correctly, as long as you choose the correct lipo for your body and do your research and ask your doctor, you know, these are my goals. Can we achieve this with this type of lipo? What kind of lipo do you do? What is the healing like? All of these different things, you will be fine. Also making sure that you are doing proper aftercare. Again, just like a tattoo, you have to take care of these things, but this is a lot bigger than a tattoo. And it's a lot longer of a process, and your body's going through a lot more than it normally would if you were just getting a tattoo. So please, please, please make sure you are researching your kinds of lipo. Also, you can feel free to reach out to us, DM, call, text, email, anything like that to get more information on different kinds of lipo, what kind of lipo we would suggest for you. We do offer pre-op consultations on the phone, online, also in the office with us, so we can help you choose a surgeon here in Jersey or even in Miami. We work with tons of surgeons in New York and Miami for the right kind of lipo for your body. Again, not everybody is a candidate for every type of lipo, and there are several types of lipo out there that fit everybody's body and everybody's needs differently. So please, guys, do your research. Again, lipo is not a weight loss procedure. Yes, you will see some of that fat and some of those pounds coming off, but you have to be taking care of yourself and you have to lose weight beforehand. Lipo is a sculpting process, whether it's AirSculpt, TrueSculpt, SonoBello, goals, all of these different new things that are coming out, even with cool sculpting, which is, you know, not lipo, but it's supposed to freeze the fat. It's the same thing. Those cells are dying inside of you and your body is trying to filter them out. You should still be in a garment. You should still be coming to get lymph drainage, even though they say it's not necessary. It absolutely helps the process because, again, that fat is being taken out and your body has to close that space and heal, which is why a compression garment is so important and why lymph drainage is so important. So again, if you guys have any questions on lipo, any more things that you have that you've heard about that you're not sure about, we would be more than happy to do a video on them. Please stay tuned for the other lipo videos coming soon, as well as videos on other procedures such as BBLs, fat graftings, implants, all kinds of things that are coming out nowadays. So I hope to see you guys soon. Thank you for watching. Have a great rest of your day. Bye.